away from the workplace, there's an additional kind of business case around reduced pressure on the NHS and traditional healthcare from EAPs. Could you talk a bit more about that?
It's funny actually, because we've been trying to speak to the government for a couple of years about this now, and obviously changes in governments haven't particularly helped the situation, because you just get new people that you need to re-engage.
Start the conversation again.
Every week we will get people who ring us up on our EAP helpline and will say to us, my GP's recommended that I ring you first because they've said that I'm more likely to get support quicker through you than if they put me on one of the NHS mental health pathways.
Wow.
And what's great sometimes, Matt, is that these are absolutely things that an EAP was designed to help with, perhaps lower level issues of anxiety, depression, low mood.
Sure.
But sometimes there are things that people are ringing us up about that EAPs were not designed to support with, and in fact don't have necessarily the expertise to support with. You can imagine some of the more complex and serious matters which would typically result in quite complex referrals on NHS mental health pathways. EAPs aren't generally equipped to deal with those, and of course that then becomes a challenge for the EAP and for the service user who's rung up about that. But no matter how you look at it, having solutions like EAPs reduces some level of burden on the NHS. And that is absolutely a good thing, because it means that the kind of things that EAPs can help with and deal with will free up time for the NHS to deal with more complex matters.
Sure, yeah.
But I think it needs some realisation from whichever government's in charge that they should make an investment in that they should provide support, particularly for SMEs, to put in place these kinds of alternative solutions which will help free up NHS time.
I thought that's where you were heading with it. So it's in terms of the request, in terms of what that conversation looks like at government level, it's a case of maybe looking at some kind of subsidised EAP system, so that like you just said there,
exactly
small
that,
businesses
along
can get
with
that support.
a recommendation, or even strong suggestion, or even to a certain extent some kind of mandate that there are a minimum level of benefits and support that employers are required to provide to their people.
And with that in mind, how close or how far away are we from, if that's the ideal scenario, how close or how far away are we from that potentially being a serious conversation?
It has to be balanced, of course, with the fact that more regulation for small business is also a challenge, absolutely recognise that.
Yes.
So it's not an easy conversation to have, it's not an easy analysis to undertake, but I think from an economic perspective and from a balancing the government books and balancing the ever-increasing NHS waiting lists perspective, it's a conversation that we need to have.
Absolutely. Okay. And just talking about timescales now, more specifically trends over time. How have you seen the perception and use of EAPs change? Specifically, if we're talking about, before, during, and after something like the pandemic.
So broadly speaking,
yes,
EAP usage has increased massively. I think, I don't think I'm going to say anything new here. There are people a lot more qualified than me who've said this, but I don't think that the increase in awareness and utilisation of mental health related services, I don't think that is entirely a result of a worsening of mental health since the pandemic.
Right.
I think that is responsible for an element of it, but I think a large element of it is due to an increased awareness and increased openness and increased transparency and increased acceptance to talk about, recognise, understand, accept mental health issues amongst individuals and all levels of mental health and well-being concerns. You know, I don't think that March 2020 suddenly hit and the nation's mental health went, you know, suddenly
Took a nosedive.
I think absolutely the pandemic had a generally worsening effect for certainly a period of time, and certainly affected some people more than others. But what I think is probably the main driver is, and this is an amazing thing, is that we've all become much more confident about talking about mental health.
Yeah, which ultimately the net result has to be a positive thing.
It's an amazing thing.
Yeah.
We're lucky to be working in this space whilst that is ongoing, because
So lucky.
let's face it, this was something that, you know, as I say, I've only been in the sector for about 3.5 years, but I meet colleagues who have been banging this drum and working all hours to raise awareness about this for 10, 20, 30 years.
Sure.
And for them, there's finally some light at the end of the tunnel because of wider public acceptance.
Yeah, so like you say, it's not a new conversation that we're having now. It's just that the focus has shifted, and that is one of the net results, one of the kind of lasting legacies, if you like, of the pandemic.